Okay, now I'm going to do a basic liver Doppler with the protocol that's used for ScanLab. So there's two different regions we can get the portal vein. We can get it from the anterior abdominal window here, or we can get it intercostally out here from the side. When we get the portal vein from this window, notice that the portal vein runs horizontal on the screen. If we were to put color on that, it's going to be blue because it's interpreting it as blood flowing out of the liver or hepatofugal. But we know that that's not true. The blood is flowing into the liver. So the best way to image the portal vein is intercostally. It's best to go out here to the intercostal window with your marker at about 10 o'clock to try to get the portal vein running more vertical. Okay, a little breath in and hold it. So from this window, we can see the portal vein running up into the liver. And when we turn color on it, it is red, indicating that it is hepatopedal flow. Go ahead and breathe. So our first image is we're going to take in a 2D image of the portal vein. Big deep breath in. Our next image is to show that with color. Go ahead and breathe. And then now we're going to obtain a PW spectral Doppler. So I'm going to go ahead and put my cursor in there. Go ahead and just stop breathing. Stay right there. And breathe. And here we show that the flow is above the baseline, coming toward my transducer, and this is exactly what we want the portal vein to look like. You can even measure the flow velocities if you need to. Now we need to get the right and left portal vein branches. So you can also get those from this window, and here we can see that she has a nice bifurcation of her right and left portal veins. So we're going to go ahead and turn color. And then we're going to obtain a Doppler in each. So I'm going to begin with the left one. Whenever you're ready, just stop breathing. Okay, go ahead and breathe. And there we have normal flow in the left portal vein. Go ahead and breathe. And here we have flow in the right portal vein. Now we're going to go for the hepatic artery, which runs right next to the main portal vein. So here we have our main portal vein, as we already have seen. And if you notice, right next to the portal vein, we have this area of flow turbulence where we have higher velocities, and that is the hepatic artery. So you can see that it's running right next to the portal vein. Okay, whenever you're ready, just stop breathing. And now we're going to get a Doppler in the hepatic artery. Go ahead and breathe. And here we can measure flow velocities if we need to. Now we can also get the hepatic veins from two different windows. We can get them here, or we can also get them intercostally. So it's just up to you which ones that you prefer. So here we can see the hepatic veins, or from the anterior window we can see the hepatic veins. So first we're going to just show a 2D grayscale image of the hepatic veins. Okay, a little breath in and hold. And then we're going to show color. Go ahead and breathe. So here we have our right, middle, and left hepatic veins. Now we need to obtain a Doppler in each one of those. Okay, whenever you're ready, just kind of stop breathing. Okay, go ahead and breathe. And we have a classic hepatic vein Doppler waveform here where we have our upside down W, which is what we want to see of blood leaving the liver, which is hepatofugal. Now we're going to go ahead and get the middle one. So whenever you're ready, just kind of stop breathing. Go ahead and breathe, and that's completely normal waveform. Then we're going to go for our right. Okay, whenever you're ready, just stop breathing. Go ahead and breathe. Notice that this one is harder for me to get my Doppler angle in the correct position where it's parallel to flow between less than 60 degrees. So for this one, I'm going to go ahead and move to the intercostal window to get the main hepatic vein, the right hepatic vein, at a much better Doppler angle. So now you can see that the right hepatic vein is almost completely parallel to my sound beam, and that's going to be able to give me a much more accurate angle. Okay, go ahead and stop breathing. Okay, go ahead and breathe. So that is my right hepatic vein. So we can use either window. We can get all of our hepatics from over here intercostally, or we can get all of our hepatics over here in the anterior window. You just want to use whichever window is going to give you the best Doppler angle, which will give you the best Doppler information. The last part of our basic liver Doppler scan is to get a 2D image of the inferior vena cava. So I'm going to go ahead and turn longitudinal here, and I have a beautiful image of our inferior vena cava, and I could follow that down through the abdomen if I want to. Go ahead and take a little breath in. I'm going to turn color, and then I'm going to go ahead and get a Doppler in the inferior vena cava here as well. Go ahead and breathe. And that's how you do a basic liver Doppler.